A dysfunction syndrome arises from a past history of some kind, such as a trauma or a previous episode of back pain, or it can arise insidiously, resulting from years of poor posture or degenerative changes. Whatever the initial cause, adaptive shortening of tissues now causes a painful, restricted end range. Pain is produced each time the affected tissue is stretched or compressed, but abates as soon as the position is released. In each instance, tissues have gone through the repair process, but have not been adequately remodeled to return to full function. In dysfunction syndrome, pain is never constant and appears only as the affected structures are mechanically loaded. Pain will stop almost immediately on cessation of loading. Movements and positions consistently cause pain to be produced, but symptoms cease when the position or loading is ended. Following tissue damage, an important factor in physiology of repair is the phenomenon of contracture of the connective tissues. A characteristic of collagen repair is that it will contract over time. This contracture, occurring from the 3rd week to the 6th month after the beginning of the inflammation stage, forms scar tissue which will always shorten unless it is repeatedly stretched. Contracture of old scar tissue may in fact occur for years after the problem originated. Cross-linkage between newly synthesized collagen fibers at the time of repair can prevent full movement. Nerve endings infiltrate this area as well during the repair process and can make the scar tissue a sensitized nodule of abnormal tissue. Internal derangements cause a disturbance in the normal resting position of the affected joint surfaces. Internal displacement of articular tissue of whatever origin will cause pain to remain constant until such time as the displacement is reduced. Internal displacement of articular tissue obstructs movement. Derangement syndrome is characterized by a varied clinical presentation and typically responds to loading strategies. This includes worsening or peripheralization of symptoms in response to certain postures and movements. It can also include the decrease, abolition, or centralization of symptoms and the restoration of normal movement in response to therapeutic loading strategies.